For this next interview, join us for a look into the emergency helicopter landing pad at Hadassah in Kerem, a site that has received victims of terror and wounded soldiers for decades, and even more so since the war began on October 7th. Joining us are Dr. Yoram Weil, Director of the Orthopedic Trauma Unit at Hadassah in Kerem, Dr. Yona Ofran, Department of Physical Medicine and Rehabilitation at Hadassah Medical Center, and Dr. Shir Shabbat Ben Yehuda, Senior Resident in Rehabilitation at Hadassah.
Thank you all so much for being here today.
Thank you.
Thank you for inviting us.
Of course. Now, I want to start actually by thinking about the fact that we are 2 years since October 7th. I assume that the kinds of injuries and patients that you're working with have changed. Maybe, Dr. Shabbat, you can start by telling me what kinds of injuries are you still seeing today, and how has Hadassah adopted its responses from those first chaotic weeks of war to now?
So at this point, 2 years after the outbreak of the war, we don't see a lot of new wounded citizens and soldiers, but we continue to treat the wounded soldiers and civilians that we admitted in the past 2 years that are still suffering from physical limitations, emotional distress, and chronic pain. For some of these patients, they are at crucial crossroads, returning to work, returning to active military duty, or resuming studies. I think that in parallel, we continue treating patients from all over Jerusalem and the area after CVA, traumatic brain injuries, after car accidents and fall from heights, spinal cord injuries.
Of course. And Dr. Orfan, can you piggyback on that and speak a little bit about the difference between the chaotic first weeks of war and the long path of recovery?
In the beginning, in the hospital and in all of the Israeli society, we had to react very quickly to the trauma when we were traumatized ourselves, staff, communities. People were out of their homes, out of the communities. Children were in the reserve army. About a third of our staff was in the reserved army, or their wives were holding their homes by themselves. We had to quickly organize a service that would fit the enormous numbers of patients that came in. Through time, we moved to the new Gandel building that enabled us to take care of this huge population, and we started regulation, and we could react, not chaotic emergency reaction, but planning ahead, giving the right treatment, fitting the treatment to the various injuries, opening clinics, preparing for the next stage of the long-term rehab. As Dr. Shir mentioned, opening the long-term clinic. We have combined clinics with orthopedic doctors, plastic doctors, fertility doctors, sexual rehabilitation, long-term daycare rehabilitation, everything that could help people regain and return back to their lives.
And Professor Weil, in your case, orthopedic trauma has really moved at a record pace this year. What breakthroughs now let you save or rebuild limbs that once would have been lost? And how are tools like 3D printing and planning changing the outcomes for your patients?
In Hadassah, we really fought hard to save limbs. Most of the injuries involve the skeleton. Like 80% of the wounded involved the musculoskeletal system. So we were the busiest. Orthotrauma was the busiest service in the hospital. Personally, in October 7th, I was in Belgium instructing some course, and Hadassah flew me as soon as they could. And I think in contrast to other hospitals, we saved a lot of limbs. Our amputation rate was one of the lowest in the country. And we, of course, utilized whatever resources we had. We didn't save anything. And some 3D printing technology was used, especially for missing parts of joints. This is a real novelty. We actually printed a few implants, and after it also we used it for civilian trauma as well, and of course 3D planning. The second wave actually is still going on, and we are getting, as a tertiary center, all the complications of cases done elsewhere that didn't succeed. And we also put a lot of effort in providing advanced trauma care, for example, treating bone gaps, infections, non-unions, all of these very hard to treat conditions. And I might mention the excellent cooperation with my colleagues here in rehab, that they do an amazing job with this beautiful center that they built, and we try to cooperate as much as we can so we can do the first step, but most of the work is up to them.
Yeah, and I want to go back to that, to the first step, because, Dr. Shabbat, you meet patients at that most fragile moment early on and they enter the rehab ward. What does day one of rehabilitation really look like in 2025, physically and emotionally? And what have you learned about motivating people when they're really exhausted by all the pain and trauma? While answering, if you can touch on the combination of the physical and the psychological and how that works together.
Okay, so as said, in January 2024, we moved to the new Gandel Rehabilitation Center. That enabled us to triple the number of inpatient beds and the number of patients we're treating in daycare programs. So we had to start and learn new expertise because patients began to arrive only days after injury, sometimes immediately after the intensive care unit. We needed to know how to treat fresh wounds and pain management, and to wean off tracheostomy, to collaborate with other hospital specialists, to continue the acute care while beginning the rehabilitation process. For many of these patients, the psychological aspect has not yet been treated or processed in this stage, so they came with acute stress disorder. And so we have a big team of psychologists and social workers. Each patient goes in a very unique and specific assessment in the beginning, in the first week of the hospitalization, and then they are followed through the rehabilitation journey. We also have dog therapy, groups therapy led by social workers for the patients and their families, acupuncture, and yoga therapy.
It's pretty incredible. And I mean, Dr. Efron, you actually play a very big role in that because from what I understand, you run the daycare rehab, and that can last for months or even years in some cases. What enables sustained progress for a patient to be able to be discharged? And what does a good day look like for a patient? Maybe also touch on the role of family, community in that long rehabilitation process.
As Professor Weil said, the first stage is saving life in the first ward of hospitalization. Then they start walking their first steps and standing on their feet in the inpatient rehab. But there's a huge, long journey to come back into life. I like the Hebrew word shikum, because rehabilitation is getting back to your habits prior to the injury. And shikum in Hebrew is from the word lakum, to stand up. And a person has to evaluate all his prior abilities that give him the strength, his personality, his values, his family, his community, learn his new abilities, and regain back physical abilities. And with all that, he has to choose a meaningful life that could bring him back to being a donor himself to his community and growing up. I think the sense of meaning and the sense of community are the strongest strength of our Israeli patients. People finish their rehab and want to run back into the army service or return back to their homes and take care of their children. We have patients that married through their rehab and they started new families that run back to study their academic studies during rehab. We move out the treatments to different days to enable them to continue with the life and dealing with a great life journey of sometimes pain, trauma, losing friends and family. and rebuilding and finding their way.
Professor Weil, if I can turn to you, there is such a need for coordination between the orthopedic surgery department, of course, and all of the staff, working in the rehabilitation wards. It's crucial. So, what do you do now in the operating room that sets the patients up to be able to transition more effectively to work with the rehab department? And also, is there anything that philanthropy or policy could have solved right away? Do you ever have any bottlenecks that should be easily solved, but they're just not the right tools in place?
Okay, so for the first question, I think it's a global trend in orthotrauma, not war-related, but we do now our best to enable as much as we can immediate mobilization, including weight bearing and movement of the joints and muscle exercises. So we try to do a better job in fixing the fractures and stabilizing the tissue. So my dear colleagues here will enable to work better with the patients. So it's crucial, and sometimes we can't if we have comminuted articular fractures that involve the joint. But even with that, we try our best to do our best job to create a stable situation where the patient can mobilize earlier. I just came back from a meeting in Switzerland, and we were discussing that among our colleagues from all over the world. It's a global trend right now.
Wow.
The second thing is, I think the war had actually given us a great opportunity with rehab, especially when they opened this amazing building, that now patients can even transfer, as Dr. Morez said, even in the acute state. So they don't have to wait even for suture removal or to make appointments or to have their financial situation solved with a health provider in order to go to the rehab. And it's a win-win for us because the patient is immediately starting his rehab, and whatever there's a question, there's a problem, the communication is direct, and we can intervene if necessary. If secondary procedures are needed, then it's very easy to move the patient across hospitals and do whatever we can. So it's a big bonus for us.
Sure.
I hope it will continue and will be also for all other trauma situation, not just in war.
Sure, of course. And I mean, there was already such a deficit of rehabilitation centers, certainly in this area of the country. And the Gandel Rehabilitation Center has provided, for this a very acute need. I think that we knew it before October 7th, and it became even more essential, of course, after the tragedy of that day. And speaking of the Gandel Rehabilitation Center, Dr. Ofran, it really has to expand capacity and services in Jerusalem. I'm wondering if you can just talk about some of the capabilities, the teams, the tech, the therapies that have most changed your practice, now that you have this center. Just in a 1-minute answer, if you could kind of give us those highlights.
So just to understand, we grew from 24 little ward to triple the size of 2 big wards of 74 beds, and we doubled our outpatient services.
And it's the only
And
center of this kind in Jerusalem, correct?
It's the only center of this kind for young people in Jerusalem. We literally stepped on each other's feet. So that space enabled us to walk with a patient 400 meters and have high technology, the best technology in Israel. People from other hospitals comes to see.
You can see how proud you are, and it's really, I've been to the Gandel Rehabilitation Center, and it is really an unbelievable place. I want each of you to share a story. Obviously don't share the names of the patients or anything private. I don't need to tell you that, but something that really captures the resilience of what you've witnessed. Dr. Shabbat, why don't you start?
I would like to share the story of a lone soldier, an American citizen, that was wounded in Lebanon a year ago. He was supposed to get married only a month after his injury, but instead he spent the whole year in the ICU at Hadassah and Karem, and then in the rehabilitation center of Hadassah Mans Campus. So this patient, he sustained a traumatic brain injury, a very severe one, and injuries to both of his legs. He had compound fractures and vascular injury, nerve injury, and extended wounds. At Hadassah and Karem, they were able to save his life and to save his legs. And then he was moved to Hadassah Mount Scalpus to the Rehabilitation Center. At the beginning, he couldn't communicate. He suffered a great deal of cognitive impairment. He couldn't walk. He couldn't even move his right leg. And he was screaming from pain. And gradually, with a very intensive rehabilitation process, he, with careful medication engagement and management, with physical therapy to his legs, with cognitive occupational therapy and psychologists that followed him, and a social worker that followed his fiancée. He's now walking, he's communicating, he makes us all laugh. And just a few weeks ago, he got married to the love of his life. And the entire rehabilitation team had the privilege to dance with him in his wedding. It was a truly very emotional moment that gave us all the strength to continue doing what we're doing. And with a lot of support of the Hadassah Women's Organization and the Jewish community from all over the world.
Well, Dr. Shabbat, Dr. Ofran, and Professor Weil, incredible stories, incredible strength, and certainly, as you said, we're in it for the long haul with all of the rehabilitation. So thank you so much for being here.